And welcome back to the Kiosk Presents. Fibromyalgia is causing a lot of pain to a lot of people throughout the world. Pfizer recently did a study on it and found some interesting facts. Joining me today to talk about it is Jan Chambers. She's a fibromyalgia patient and she's president of the National Fibromyalgia and Chronic Pain Association. Dr. Golden is the president of the American Association of Nurse Practitioners. Thank you so much for joining us here in Buffalo and West New York.
Thank you for having us.
Now, what is fibromyalgia and how many are affected each year?
In the United States, 5 million Americans are diagnosed with fibromyalgia, so more are affected and may not have the diagnosis. But it's a condition that's characterized by chronic, widespread pain. A lot of my patients will tell me their skin even hurts when it's touched. So the other addition to that is that to meet the diagnostic criteria of the American College of Rheumatology, that widespread pain has been occurring for 3 months or more.
Yikes, that's a long time to be in pain.
Yes.
What are the other symptoms?
So some of the other symptoms can include, one of the big ones is fatigue. And additionally, they might have some gastrointestinal issues. A lot of people have migraines with this. There are a cluster of other symptoms that occur with this, but 8 out of 10 patients in the survey said pain was the #1 reason that they were missing out on events in their life.
Between pain and fatigue, I could see that.
Yes.
If you're in pain for over 3 months, I'd be tired too. Now, a nurse practitioner could be helpful to a lot of patients. What is the difference between just having a nurse practitioner helping you or having a physician helping you? What can each provide?
So what a nurse practitioner provides, they started with their nursing degree and then added advanced practice so they can diagnose, treat, prescribe medications. But what they bring to patients with chronic disease is really the opportunity to partner with that patient and create an action plan. And especially in something like fibromyalgia, that action plan or toolkit, as Jan calls it, is what's going to help them in the long term manage their fibromyalgia.
Okay. So it's a more face-to-face person who you more regularly see, perhaps?
And I think it's just the more of the communication and the ability to partner with your healthcare provider and your patient together. And that communication that comes from our nursing background follows us into advanced practice. And I think that's what makes patients very satisfied when they see a nurse practitioner.
That makes a lot of sense. Just someone who knows how to listen a little more.
Correct.
All right. Where can people go if they want to find out more information about fibromyalgia or about the study?
There's a terrific Facebook page, Fibro Center, and also fibrocenter.com online as a website has a lot of information, not only about the survey, but also tips about daily living and how to improve the quality of life with fibromyalgia.
Okay. What would be your advice if someone believes has been in pain for a long time and they think it might be caused by fibromyalgia?
I encourage people to immediately see their healthcare provider. The sooner that fibromyalgia is diagnosed, the less severe the symptoms are over time. And understanding what needs to be addressed by with their provider is important, because what may be important to that person isn't the same as the next patient.
All right. Well, thank you so much, Dr. Golden, for joining us here in Buffalo, West New York, and for letting us know about fibromyalgia and about potential options to help people get it treated. Have a wonderful day.
You too. Thank you.